selamat datang ya kepada Pak Yudi dan tim dari fakultas dan semua peserta untuk hari ini. Welcome to meet you in today Chemical Sensors and Biosensors lecture series. Welcome Dr. Arif, students, and all attendees. Actually, last week we have attended Dr. Arif lecture on nanomaterial applications in sensors. And today we will attend a lecture on point of care testing or diagnostics. All right, since today is used as a public lecture, let me to introduce Dr. Arif first. Dr. Arif Engin Cetin is a research group leader in Izmir Biomedicine and Genome Center in Izmir, Turkey. He received his PhD degree from Boston University, Boston MA. Okay. He worked as a postdoctoral associate at EPFL Switzerland and MIT Massachusetts MA and research scientist at Omnion in San Diego, CA, USA, right? Dr. Cetin pursues research on optical nanobiosensors integrated with microfluidics, handheld biosensors for high throughput, and multiplexed biosensing, electromechanical biosensing. Okay.
Yeah. Should I start?
A growth rate
okay. Sorry.
and label-free technique for DNA sequencing. Okay, it's yeah. Okay, please get Dr. Arif to start. It's your time now.
Okay, thank you. So today it will be a lecture for point of care testing and diagnostics. I will give you some general idea what is point of care testing. I will give you some information about how they use, why we need them, and at the end there will be some concerns about point of care testings, and I will give you a couple of examples on point of care testing from my lab. So let's start with the definition of the point of care testing. So point of care tests or POCT devices. So they could be either a test methodology or a diagnostic tool, and they are so they provide clinically relevant information without the need for any medical infrastructure. So these are so you can perform these tests or you can use these devices without need for any laboratory environments in the field, such as rural areas or airport. So these tests provide these information at the point of use or where the patient with the symptoms exist, with either no sample process or sample processing with very easy to choose steps. So ideally, these tests should give you results within an hour. It could be more than an hour, but its ideal is 1 hour. So these within this 1 hour, these sample content, this 1 hour is composed of sample taking, processing, taking the design, taking the tests, and giving the results. So POCT could be also people use these terms too for POCT. For example, near patient testing, bedside testing, extra laboratory testing. These are also used terminology for POCT too. There are also some very rare use like terminology used for POCT too. Alternate site testing, physician office testing, out of laboratory testing, patient-focused laboratory testing, or decentralized testing. These are other terminology when you when you want to use accept POCT. So where can we use those tests? First, home, in pharmacy, health centers such as hospitals. They could be used in ambulance, emergency rooms, operating rooms, in the rural areas, in the field settings. So these are the main spaces we can use for POCT tests. So there are some important features of the POCT test. So let me use my pen. So first thing is it has to be near the patient. So for example, POCT test can be right away used when for a patient or a person with the possible symptoms, that the symptoms that show that is related to the related to a sickness. So for example, in COVID-19, when we think about the COVID-19, so when you see the symptoms such as high temperature, body temperature, cough, so this first you have the symptoms, then you decide on doing the test. So the second important feature is the quick response. You shouldn't wait for hours or days. So the thing is, they give you the response within a couple of hours or minutes. So then so it's like point of POCT test is like a pre-test to determine the possible sickness. Then you use these tests before the general test with the tests in the medical infrastructure. So it's like pre-screening tests. So POCT, you shouldn't use these tests to reliably diagnose the patients if you use POCT for diagnostics. They could be used for pre-tests for diseases, but they shouldn't be used as the real diagnostics for a patient. So the sample is not transported because since POCT tests are performed just next to the patient, they are not transported to a central lab. So for example, when you think about blood tests, so you accept by the hospital, you go to a clinician, the clinician asks you to give a blood test, you give your blood test, and they take your blood test and they send your blood to another lab or another center to be tested, analyzed, and give the result back to the clinician. So all the analysis, the sample, so both an analysis and sample collection is simplified in those POCT tests. As I told you in the previous slide, within that 1 hour, the sample collection also is included. So sample collection and processes should be also simplified to give the results as fast as possible. So since the analysis and sample preparation since the analysis and the sample preparation is simplified.
Belum saya kerjain tadi. Sama Pak Arif udah kan?
Did you ask me the question? Sorry. No. All right. So in this test, since the analysis and the sample collection is simplified, these platforms don't need well-experienced operators. Here, for example, when you, again, the same example, when you give your blood for the test, so there are certain, not everyone can do those tests. So there should be a well-experienced and educated operators to perform these blood tests and give you the meaningful results. So we don't need any doctors, patients, or nurses to perform these tests and also to evaluate not just the preparation of the samples or perform the test, also the evaluation, because the POCT tests already give you the evaluated results. So they give you, okay, you have this much. So you have, so if it is a glucose sensor, so it gives you the glucose level. If it is a virus test, it gives you whether it's positive or negative. So you don't need an operator to evaluate the test results. So the other feature is these are rapid tests, and they can be used for screening, monitoring, and diagnosis. So they can be, for example, again, the glucose tests, you can daily monitor your, you can daily monitor your the glucose level in your blood. Diagnosis, for example, in COVID-19, the POCT test gives you positive or negative results. So the screening and monitoring could be used as a daily daily test to evaluate your symptoms that relate to a disease, or a diagnostics. It's like on and off tests which give you the direct information of the disease. So another feature, so point of care tests give the results in real time. Real time means within a couple of hours you have the results of the tests. So if we think about the diagnostics for the cancer research, when you give the results, when they have the biopsy, you get the results within a couple of days. So with the point of care tests, the test results is given within a couple of minutes when the patients, right after the patients use the POCT test. So for example, if you take a test for influenza, the healthcare practitioner, that could be nurse or doctor, can explain why you don't need antibiotics, and instead treat you with antiviral medication. So here, as you see, so when you use the POCT test, even you have some symptoms, POCT helps you to diagnose with a high reliability, because you have the symptoms and a test result. So instead of using antibiotics for a viral disease, you get antiviral medication. So it helps you to rapidly diagnose the sickness. So it's better to have to use the POCT test. It's better to have it's more ideal to have the patients with the symptoms. Without using the POCT for a person without any symptoms, it's a waste of time, money. So these tests help doctors or clinicians to improve their success rate on diagnostics for the diagnostics of a disease. So there are two types of tests. So one of them is the classical laboratory tests, and the other one is the POCT. So the POCT, when you see, so the test will be more likely doing in the home settings, while the laboratory take you from home and send you to the healthcare center. So POCT wants you to stay at home and take the test yourself. So let's look at two scenarios. One of them is the classical scenario, and the other one is this one is the POCT. So in the classical in this classical way, you go to a hospital. This is triage. Triage means you accepted by the hospital. As a clinician saw you, and then based on your symptoms, that clinician sends you a laboratory to collect sample. This could be urine, blood, or any other patient sample. So they collect the sample, they process the sample, perform tests, and from the test they compile results. So that clinician again see your test results, either tell you to take medicine, stay in the hospital, or discharge. In the POCT, on the other hand, the sample, you right away collect the sample, load the sample to the POCT platform. POCT platform analyze, perform the test, and give you the analyzed result right away to you. And then either you get the positive results and go to a hospital, or if it is the negative, the case discharge. So there are different types of POCT devices. So when you think about the POCT test, the devices could be optical, electrochemical, completely chemical, working with the color-based dyes. It could be electrical, mechanical. There are certain types of different types of POCT devices. So, for example, blood glucose monitors. These devices use the strips, and then they use an electrochemical method to analyze your glucose levels in your blood. So this is called it's an electrochemical method. So heart and blood pressure, they're using electrical methods to count your pressure, heartbeat and pressure. Sorry, it's pacemaker. There are also HIV and pregnancy tests here. So these are chemical methods. So there are some certain reactions in the POCT platform, and this, due to these reactions, you see color differences due to a color. So the colored dyes in the POCT devices. So there are different methods that, and then these devices developed based on the sickness or the illness. So for different targets, you should choose different methodologies in terms of optics, electrochemical, or electrical. So POCT devices are suitable for diagnostics in situ, in the field. In the field means that you can use POCT devices anywhere, in airport, in home settings, in the rural areas, any areas, any location without a well-developed infrastructure like hospitals or laboratories. So actually, point of care results give you similar results without the need for a laboratory. So actually, what it does is it brings the laboratory results to the field settings. So with the emerging technology innovations such as smartphones, especially smartphones, biosensors, lab-on-a-chip devices, and wearable devices, these POCT technologies have become more quicker and becoming the part of transformation of the healthcare landscape. So with the current, so maybe 20 years ago, POCT devices were not that they were not that highly used all over the world. They're now widespread, and they can be used everywhere in the world. For example, with the COVID-19 tests, when the pandemic just started, if you don't places like the countries with lack of PCR tests, they were using these 15-minute POCT tests. They were low precision, but still, if you don't have the PCR machines, then you have to rely on those devices. So with the smartphone, the most important part is, so the last part of a test, the last part of a test is the analysis part. Since the current smartphones has the technology of maybe 5 years, a 5-year-old laptop, they have strong computational capabilities. So we can use smartphones to perform the test, send the test, analysis the data. We can use smartphone for from different aspects. For example, when you look at this picture, the smartphone and integrated to a simple optics, you can use this platform to diagnose eye diseases. So this is called ophthalmology. So these clinicians could use smartphone to investigate any problem with the eye, take the image, and even take this image to a central lab to investigate the problem with other clinicians. So smartphone gives us more flexibility for the analysis part of the point of care. So we can perform analysis, or we can send the data taken by the smartphone and send the data to a central lab to perform tests, and this test could be sent back to the clinicians to the smartphone through internet, and the clinician could diagnose the disease. So the biosensors, there are different type of biosensors, electrochemical biosensors or optical biosensors. These biosensors help build POCT devices with new methodologies. For example, the quick COVID-19 tests are based on chemistry. So they use a lateral flow-based antibody and lateral flow-based electrochemical sensors, and then these color and the color change because of some reactions. You see the test result with naked eye. So the biosensors, with the development of new biosensors, actually the numbers and the kind of POCTs increased maybe within the 10 years. Lab-on-a-chip devices. So the lab-on-a-chip devices help us to simplify the sample collection and send the samples more effectively to sensor location in the POCT device to create more meaningful results in the point of care tests. Wearable devices, there are some certain wearable devices, they're electrical devices. These devices can help you to monitor a person in real time, even 7/24. So, for example, the last version of the Apple watches, they use two LEDs in green. So they use two green LEDs to monitor to monitor your blood to oxygen level. So they send this LED light, and then they collect this scattered light, and then based on the scattered light, they could even monitor your oxygen level in your blood. There are also other wearable devices. They can use the sweat as a sample, and from that sample, they can monitor the glucose level. So in real time, you are able to monitor your certain features in your blood. So there, as I told you, there are different types of POCT devices, electrochemical POCTs, electrochemical biosensors, integrated to a microfluidic chip, which makes it a lab-on-a-chip device. There are other devices, optical POCT devices that are integrated to a cell phone. Yeah, this is another platform. They use a separate platform to do device and take the color coming from that device with a smartphone. So it's something like a platform, nucleic acid amplification test platform. It's a separate from the cell phone, but it's a combination of this device. Is a lab-on-a-chip device. This device is used to have a color change, and you can send the test results through a cell phone to a central lab. So in global market, the POCT in 2018, the POCT in globally gets $27.5 billion, which is and it's growing. It's starting 2018 and it's growing toward 2026. So since with the current pandemic, we see that the different types of POCT diagnostic devices are needed for rapidly growing diseases, or we could also use these platforms to decrease the costs for the diagnostics, which need to be monitored daily based. So in the future, the current market, the healthcare market, the POCT diagnostics takes the 9.3%, but probably in 2016 this percentage will be over 15%. So these are the current market in 2018. So as I told you, the most widely used POCT test is the glucose monitoring. Infectious disease, now probably this year it's adapt a lot to the percent I told you, the infectious disease with the COVID-19. Millions of POCT tests were sold throughout the world. Another well-known POCT test is pregnancy tests. Urine analysis test is another POCT test. This helps you to test your own urine in the home settings. Hematology and then fecal occult testing. These are some tests, POCT tests, taking the big portion of the market. So in 2015, as I told you, the percentage in the healthcare market for the POCT dramatically increased. Will dramatically increase. These slides were prepared last year, so this infectious disease part were completely missing. Probably this one will be much higher today. When someone make this analysis, probably this POCT, the portion of the POCT devices for the infectious disease is much higher right now. So there are different types of sensor technologies enable the rapid analysis of blood samples for many clinical care tests, for example, such as electrodes, blood, gas, or hematology. So here you have flexible materials as a substrate for your sensor, or you can call it a chip, and you integrate this technology or this material with a microfluidic chamber. So the microfluidic is very important here because so you use these flexible materials as a sensor. It's hard to deliver your targeted sample right to the sensor. So these microfluidic devices are used to effectively send the collected sample to the sensor location. So for example, you collect, let's look at this example. So the sample, so for example, you have a blood sample. Sorry, let me raise that. This one. So let's say you have a blood test and you pipette your blood sample right in the center, and this microfluidic device send this blood sample to the sensor location where these openings are integrated to the sensor. So this microfluidic technology helps you to rapidly and effectively sense the sample to the sensor location, because these microfluidic technologies help you to use as small sample as possible. Without using those, you might need more blood sample for your glucose tests or any other tests. So with the development of the microfluidic devices, with the same amount of sample, you could have more reliable or stronger data for the analysis. So this is a schematics of how a POCT device integrated to a microfluidics. So the recent advances in microfluidics combined with the decreasing costs. Decreasing costs is here also very important. So maybe 10-15 years ago, it was much more expensive to build microfluidic platforms, because you needed a clean room environment to fabricate microfluidics. But the current technology there, even in my lab, I'm using, for example, 3D printers to fabricate microfluidic devices. So the cost of making a fluid microfluidic devices may be 10,000, even more cheaper than 10-15 years ago. So decreasing the cost of the microfluidic and integrate this technology with advanced electrochemical or optical sensors broadened the range of the application of the POCTs, which means we have more POCT devices that could be used for more disease screening. So when you look at the schematics, here you take the image. You collect the samples. Here, for example, it's blood. You started the devices. You collect the sample. You drop the sample to the microfluidics. This microfluidic platform send your sample to the sensor. The sensor the sensor platform based on, for example, here this could be, so if you think about this part as a biosensor, this part is the receptor part. So there are some biological reaction happens, and these biological reactions are sensed by the transducer here. This transducer makes these transducers transduce or change these biological signal to a meaningful analytical signal. This analytical signal could be optical or electrochemical. Then you have an amplifier to make this a meaningful data. And here, for example, these devices shows that meaningful data in its display. And you can do this, or this part, it could be, some of the POC devices have it or have not. It doesn't really matter. So if you have this connectivity, these test results could be sent to a central lab. If you don't have this, the test results right away seen by the patient. So there are available POC tests. The COVID-19 is the most important part. COVID-19 tests are the most important POC tests currently. There, I see when I look at the literature or in the market, I see COVID-19 POC tests based on optics. So in these optic tests, they look at they directly monitor the virus with some microscopy methodologies, but simple microscopy methodologies. They could indirectly see the virus. They tag the viruses. These and these tags, they could be nanomaterials. These nanomaterials or dyes help the platform to see the COVID-19 viruses indirectly. There are also electrochemical platforms. They based on the attachment of the viruses through an antibody or another ligand. These attachment on the surface triggers an electrochemical or electrical signal, and they detect coronavirus based on that. Or there are other methods, optical methods such as refractive index sensing. They detect the viruses based on the variation due to the presence of the virus. So it is also, this optical way is also an indirect way to detect viruses. So they detect the variation, the optical variation due to the viruses. So instead of directly detect the virus, they detect the optical variations due to the viruses. So there are other tests, POCT tests for HIV, influenza, the other bacteria, pregnancy tests, cardiac markers, drug. There are also some drug toxicology tests, protein tests, lipid tests. So there are many other tests, and so when you look at all this table, you see that there are wide range of POC tests, and these are all we have this much POC tests available in the market because of the recent development in the biosensors. I'm showing you the factors that stimulate us to develop more POC devices, or in other words, why we need and why we demand these POC devices. These two are together. So the technological advancements help us to develop faster and simple to use POC devices. So these technological advancements lower the need for healthcare centers. For the main laboratory tests, you need infrastructure, a well-established infrastructures, which is costly, and also you need well-trained laboratory staff. But for the POC test, you don't need any of those. You don't need a laboratory environment or a well-experienced operator. So as you realize, the world population is getting older. So there are more. That's why there are more chronic diseases that needs to be daily monitored. So instead of having these patients visiting the doctors every month or every week, POCT tests help these people to monitor themselves and send the data directly to the doctor office. So this will definitely decrease the cost for so the life-threatening disease increases, and they need to be monitored to faster to solve the to diagnose and treat these diseases before becoming a real problem. So another one is so now the new trend is to use so for example, when you look at the COVID-19 case, many sorry, is there any question? No. So when you look at this COVID-19 tests, especially for example in my case, so I'm living in a campus with a central hospital. So since it's a main hospital, they have settings for the COVID-19 treatment and tests. So people all over the city are going to that hospital to take COVID-19 tests. So the problem here is you're taking all these possible COVID-19 patients, put them in a same public transportation and send them to a hospital. So this increases the spread of the pandemic. But if instead of doing these tests in a central lab, hospital, or different medical settings, performing this test in home settings will stop these patients using this public transportation or any other or spread this disease since you don't know. So the reason is that these people, they don't know whether they are COVID-19 positive or negative. So that's why they go to a central lab. But in the meantime, they might also spread the disease to healthy people. So that's why the importance of the POCT devices also increase the number of people use those tests at home. So these is also important. This is about the economy. This is the long-term saving. Long-term savings, for example, if you use POCT device and reliably monitor your symptoms using a POCT device, you don't need to go to the central hospital. So this will definitely decrease the transportation cost. This will definitely decrease the burden to the healthcare system because every time you go to a central lab and taking the test, these are all costs to the healthcare system. Maybe this is one of the most important usage for the POCT test. For example, so in the rural places means the places without any well-established infrastructure, a hospital, or even small clinics. These POCT tests help people to pre-test or monitor their symptoms without going to medical infrastructure far away from their localization. So, okay. So changes in the healthcare maybe. So these are the reasons that make us demand more POCT tests in the market, because there is a change in the healthcare system. For example, so when you think about when you compare the current healthcare system compared to 20 years ago, 30 years ago, maybe 30 years ago, there were more centralized hospital settings. So in one city, there were 3-4 big hospitals and they were taking care of the patients. But when you look at it now, there are more hospitals, maybe small hospitals, well spread all over the city, and there are also private hospitals. So instead of centralization, the healthcare infrastructure, there are a trend for decentralization. So decentralization means people will be more so the patients, so the basic idea about this is about this decentralization is to make patients close to the health infrastructure. This is the first reason. The second reason is when you have all these patients going to the same medical infrastructure, this will be a big and heavy burden for the patient, these big hospitals, because too many patients, it's hard to respond. The third thing is if you have bigger hospitals, then it's hard to diagnose, perform the tests, and give the meaningful results to the patients all in the same platform, because then you have to build gigantic hospitals, which will be very complex for the patients. So when you think about this new trend, the decentralization of the healthcare, POCT could be one of the most important key player for this methodology, because when you have the POCT, the patients, they don't even have to go to these small hospitals or medical infrastructures. They could monitor themselves at home and send their results to the hospital settings, and they sent their results or data to the hospitals to be analyzed by a clinician, so then clinician could diagnose the person without even seeing them. So this will definitely decrease the costs. This cost includes transportation, mainly transportation costs. Second, when you monitor patients frequently, that help you to diagnose more reliably, because you monitor this person in daily basis. And you can monitor, since you can have the test results every day, you can take measure when something abnormal with the patient. So this also help the clinician to precisely diagnose the patient. So the costs related to false diagnosis decreases. So these POCT devices also make patients happy, because the patients with a certain type of sickness, they could monitor themselves in home settings, and they can definitely they can be well confident with their current situation. New diseases, for example, COVID-19 case, POCT devices can be easily adapt themselves to new diseases. For example, COVID-19 tests, these small tests, like 15-minute tests, I think they were first developed in China. They were already, they could, within a couple of weeks, they could be easily modified this test to COVID-19, because these POCT tests were developed for SARS. And since these tests were antibody-based tests, what they did is they switched SARS antibody with the COVID-19 antibody, and they released the test to the market. So they are easily modified, so they can easily release for the new diseases and new evidences. And new technologies also, as the biosensor technologies developed very rapidly, and new methodologies are coming, the new methodologies exist. New types of POCTs can be developed using the current technologies based, for example, like cell phone technologies, new electrical, electrochemical, or optical biosensor technologies, or microfluidic technologies. So health economic strategies, this also, so maybe this is the most important part of the demand for the POC devices, because, for example, when you look at the healthcare system in the United States, even, for example, for CT scan, for a tomography, it costs like more than $5,000. So when you think about the healthcare systems where the healthcare bills are so high, POCT to develop POC device help patients to monitor themselves with much less cost. The other advantage is size and portability. So since they are small and which make them portable, POC devices make testing possible in a variety of remote locations. So any disaster, like a pandemic, accident, especially military sites, most of the POC devices first developed for the military because they are the first ones they could be affected by biological weapons. So they could be anywhere, anytime, without a need for any medical infrastructure or experienced operator. So since they are very flexible, they can give you a flexibility to use anywhere in the world. For example, when you think about this malaria, HIV, tuberculosis case, in the developing world or underdeveloped world, you can perform these important tests to stop these viruses or bacteria turned out to be a pandemic. In the developed world, you don't need a POC test for these, but the test costs are high. So then you can decrease the test cost by using the POCT tests. So laboratories. So you need, for the well-developed tests in the medical infrastructures, you need a well-experienced laboratory, a well-experienced and educated laboratory. But the laboratory, the laboratory staff shortage, especially in the third world countries, demands tests with simpler sample preparation and simple analysis, and as well as easy to understand results. So less trained staff available lead to an increased level of automation. Automation here, the same thing that I told you. Automation means testing, creating signal, and having a meaningful result from the signal. It's all done in an automated manner with the POCT technology, so then you don't need anyone to perform the complex tests and also interpret the test for you. So skip that one. So let's continue with let's continue more with the benefits. So this helps you to expedite the tests and creating the results. So it's rapid turnaround time for diagnostics and management planning. Management planning here is he means to help clinicians to diagnose faster, so that the clinician manage the time for the treatment much faster compared to the classical methods, which could take days and days. Patient convenience, it's convenient for the patients because they don't have to go to a central lab which is far away from their home settings. These platforms improve patient plan care, the healthcare, so it decrease the cost for their healthcare, so then they can have a better planned healthcare. They have a better healthcare. This platform could improve office workflow through increased testing efficiency and less callbacks. So this sentence means POCT tests decrease the number of patient visits to the central hospitals, so then patients could be treated much better in the hospitals, as the number of patients are lower in the daily basis. Reduction of length of stay in emergency rooms. For example, if you use in the emergency room, if you use the classical tests, then till your test results are ready, you stay in the emergency room. But if you use the POCT test, which gives you faster result, so then you can get the diagnosis faster, so then you don't need to stay in the hospital. So this is also indirectly decrease the cost for the healthcare system, and also decrease the cost for the patient. So then, since they don't stay in the hospital long, so then their healthcare bill also less compared to the classical way. So, as I told you, the POCT platforms need small sample volume, as they integrated with the microfluidic platform, which effectively deliver the sample to the sensor location. They have reasonable cost. When you think about a PCR test, for example, for COVID-19, it's more than $100. Even I think it's like one for let's in the United States. I don't. It might be wrong, but it's more than it's close to $200. But when you look at the quick COVID-19 test, it's below $10. So when you compare the test cost, it's even more than tenfold smaller than the cost for a classical test. They can be these POCT platforms. They can be used with wide range of analytes such as urine, blood, urine, blood, saliva, nasal. With nasal sample or with the sweat. So you don't need to unprocess the specimen in the classical method. The classical methods needs complex or costly sample preparation techniques. In the POCT, you either use an unprocessed specimen or a processed specimen, but here the process are very simple. For example, for COVID-19 POCT test, the sample preparation takes like 1 to 2 minutes, and they are very simple. You don't need to be experienced professional to perform those tests. You can even perform them at home. So when you think about, again, COVID-19, all these features helps you to reduce the spread of the pandemic, because you create the diagnostic signal at the location of the patients with the, possible symptoms. Another example for the benefit of the POCT, so the POCT test could be used in the emergency situation. For example, if someone is having a stroke, a PT-NIR or prothrombin time international normalized ratio, if you measure PT-NIR, to test blood coagulation. You can determine the situation of the patient, even the patient have a stroke. So point of care tests are used also to measure coagulation during open heart surgery and organ transplants. So they can also, I gave you many examples of the use of POCT as a diagnostics, but they can be also used as a like a helper, like a test in the medical infrastructures when the clinician performs some operations. These POCT tests can give real-time information about the current situation of the test or the patient. So they don't need to, when I talk about POCT tests, you shouldn't think these are the tests just used out of the medical infrastructures. These tests also can be used in the medical infrastructure to give real-time signals to clinicians in a cost-effective manner. So there are, for example, another example, for example, delivering routine tests for hemoglobin A1C, hemoglobin or lipids at the point of care could decrease the test order for each patient by 21%. It could reduce follow-up costs for the healthcare administration by 89% and also reduce patient follow-up visits to the hospital by 61%. So these two definitely decrease the workload for the healthcare system and also reduce healthcare infrastructure, or in other words, hospitals, and it will reduce the cost for the healthcare system. So it's not only increase the quality of the patient like here, it also help the healthcare system by decreasing the number of patients so that the cost for the healthcare system. So at this point, I talked about the main methodologies used in the POCT tests, where we can use them and why we need them. But there are also certain disadvantages while you use POCT when you compare them with the classical systems. So implementation of these platforms is challenging and must be strategic. So you cannot use every POCT test everywhere. It's not applicable to some of the diseases. They are applicable to some certain type of diseases with well-known symptoms that could be detected electrochemically or optically. So kits or devices cannot be approved by FDA or any local healthcare administration because there might be, so even you develop the test, you might not get it approved. So then all your time and effort could be wasted. So I think the most important problem with the POCT is their reliability and precision. For example, when you look at the early days of the COVID-19, the quick test for COVID-19, the reliability, the sensitivity was 30%, which is low. So you have to perform many tests to diagnose that patient. Like 1 out of 3 tests were correct, which is a very low number. But when you think about the pandemic conditions, we had to accept that problem. So variable coverage and affordability, there are still some of the POCT tests, you cannot cover them with, for example, in health by the healthcare system. Okay, they are cheap, but if they are not covered by your healthcare administration, then you have to pay for it. So, so you have to these two are combined together. So inappropriate use out of the intended use or the policy, it could give you give you an appropriate data, and also it could decrease the quality of the patient. For example, these POC devices should be the appropriate usage for this platform. This POC test is you should use these tests when you see a symptoms. These symptoms, without having a symptoms, using this device and thinking about the precision issues, you can first increase the costs and waste the time for the operator. Also, it's definitely decrease the quality of the patient, because the patient would like to monitor themselves all the time. So even without the symptoms, so monitoring yourself daily, even without the symptoms, which is an inappropriate usage of this POC test, this will definitely decrease your life quality. Also, using inappropriate use also increase the cost for the cost for the tests, because even POC tests are low cost. Increased number of inappropriate use definitely will be a burden for the healthcare system. So there are some also concerns. Again, quality and precision problem. The identification of the patient. So as I told you, should be used. So for example, there was a debate in our country. So they were thinking about when should we perform the test for COVID-19? Should we perform the test for everyone, which is not ideal. You cannot perform tests for everyone. This will increase the cost a lot. Instead of performing tests for everyone, you should perform the tests for the patients with the symptoms. So the rest of the money you should use for the treatment. So this is one of the concern to identification of the patient. The third one is send the sample. How you prepare the samples. For example, one of the main reason to have wrong results for the POCT is to sample preparation part. If you prepare your sample, even if you are positive, the test give you a negative results. So there are two types of problems in the POC platforms. One of them is sample preparation, the false positive from sample preparation, or false positive because of the methodology, the analysis methodology in the POCT platform. Interference stability. These systems are and its interferences. Stability means here, for example, you cannot store these tests years and years. There are a time that you have to use these POCT tests. That you cannot store these tests for a very long time. Then there are some stability issues. If for example, if the storage or the lifetime is six months for a POCT test, and if you use it 1 year later, then the test results is definitely wrong. So you need to be paid. So the stability and stability of these platforms is low compared to classical platforms. So there is no way you report the results if you use it in the home settings. For example, if you use the POCT test for the COVID-19 in a central lab, the operator definitely put your test results to a system. But if you perform this test at home, no one really check you. And if you don't report your test to a healthcare administrator, then this report or the test result is lost. So there is no way to track the test results if the test is performed by someone except a healthcare clinician. So Interpretation of the result is another issue. So there are POCT tests. They're easy to interpret, but there are also some of them, they give you numbers, so then you won't be able to interpret. You have to send the test result to a clinician in the central lab, because there are some, for some tests, for example, glucose tests, there are like ranges instead of positive or negatives. So you have to be careful for interpreting the results when you think about the symptoms in ranges. So challenging, there are also challenges in addition to concerns and disadvantages. So POCT provides rapid results, but they have risk of errors. They're not 99. So for example, when you go to PCR has more than 99% precision, but most of the POCT, they are below 50%. So they are raises a concern over the reliability of the test results. So in contrast to the core lab, when an error occurs most frequently in the pre and post-analytic phases. I will give you more detail about what I mean by pre and post-analytic phases. So in the core lab, the error usually occurs in the pre or post-analytic phases, but in the POCT, it occurs primarily in the analytic phase of the testing. Let's go to the next one. So here, these are the phases of a test. For example, in the pre-analytical tests, you choose a test, you ask the question based on the symptoms. You look at the disease state, diagnosis. When you go to the analytical phase, you collect the sample, perform the tests, review the tests. And in the post-analytical phase, you report, so based on the test results coming from the analytical, not the test result, the signal from that coming from the test, you interpret the test in the post-analytical phase and report the test to the clinician and the patient. So in the classical ways, most of the error happens in pre-analytical or post-analytical cases so there are some certain problems when you when you do the test selection, or you use the wrong test because you interpret the symptoms wrong or things like that, or you misinterpret the test results. This is for the analytical part, but for the POCT, usually the analytical phase where you collect the sample and perform the test. Actually, the POCT, this is more problematic. Here, in the classical way, your sample collection and performing test part is very accurate. And this pre-analytical and post-analytical part is depending on the operator. So to have a problem with the classical tests are less likely. But when you look at the point of care tests, the errors mainly exist in the core of the technology. Sample collection and tests, if they are wrong, then the test is wrong. So even though they are cost effective and gives you rapid tests, their reliability is very problematic. So let's look at the challenges one more time in more clear way. So it's the management, so with the POCT level. So when you have, so you don't need any infrastructure or lab involved. Infrastructure or a laboratory environment or a well-experienced laboratory personnel. So your test results is either interpreted by you or directly coming from the POCT level. So compared to the classical methods, they have less precision and reliability. So their quality, the test quality is low compared to the classical methods. So you need multiple tests to have the reliability. For example, if you have COVID-19 quick tests, so if you perform 5 times the test 5 times, and if you get 5 times negative, then it's more reliable compared to a single test. So training, and so you have less, so you have lack of training or education. So compared to, again, classical tests, these POCT tests, the interpretation of the POCT tests are not performed by an operator or a clinician or a doctor. So again, the reliability also low because of the interpretation side. The cost and billing is good for is okay for POCT tests, but because of the low reliability and wrong usage, the cost and billing could be higher than expected. The other one is also compared to classical methods, where the data managed and connected with the central system. There is no way POCT are connected to the healthcare system, so then so that they won't be able to monitor by the healthcare administrator. Again, more cautious, like maybe small examples. If you are performing point of care tests at home, it is best to seek professional guidance. So it's the same problem. If you do it yourself and interpret the results yourself, then you either misinterpret, or if you do the test single time, then you might get and you won't be able to have an idea about the false positive. So you can easily take the result and you think that you're sick or not. So it is recommended that you learn how to perform the test with a professional supervision instead of doing it yourself. Doing it with a professional supervision, and then have an idea how to collect sample, perform the test, and interpret the test, and then have the result verified by a clinician. If you have that chance, it's of course best to have the results verified by a clinician. Another major challenge is to manage the data generated by the point of care test again. So compared to classical way, there is no way the healthcare system monitor and store the test in the cloud. So more caution, while the spread is often the usage of the POCT test, one of the main advantage of the POCT care test, the test result may not be specific or sensitive. So when you, the specificity here means, for example, when you have the COVID-19 test, COVID-19 is coming from the family from SARS virus, SARS-MERS, which exists in 2019. So, for example, if your test is antibody test, antibodies could not be 100% specific to differentiate COVID-19 from SARS, because they are coming from the same family. So specificity or sensitivity is low based on the method that you detect the targeted analytes. It's the same, for example, it's the same thing. Influenza A cannot be differentiated from B. If you have if you, for example, if you're influenza B and if you use an antibody for both, then you won't be able to interpret the results that you have A or B. You could be either of those. So this is the more important problem with the POCT tests. If the signals, if the symptoms are very similar from two different diseases, POCT sometimes fails to differentiate them. Management also, again, the problem to store the generated data from the POCT device and share them with the clinicians and healthcare system is very, very hard when the test is operated by a patient itself. And if the patient not share the test result with a clinician. This is also another problem. So since POCTs are cheap, wastely, and widely used everywhere in the world, it's a big problem to how to dispose them. For example, if you go to a central lab, they take your blood, do all these tests, and anything coming from this test as a waste, it goes to bio-waste. So the hospital take care of the waste and send it to a center to dispose. But POCT tests are sold everywhere and there is no track to dispose them. So if someone take the COVID-19 test at home, they can trash them in a trash bin. So they don't, if the patient, if they don't know how to dispose it, they can treat it as a general waste. But all the like the other tests, POCT tests or devices should be also treated as a biological waste and should be disposed as carefully in a container where the biological waste stored. But I don't think now no one really followed that, and then they just dump their POCT devices or test kits to a general trash bin. So in the last two slides, I will show you in our lab 2 examples from our lab. Since I will show you 2 examples how we can use optical platforms as a POCT example. I won't be able to give you more details because 2 of them are very confidential. One of them is submitted to a journal, and the second one is a confidential because of the financial issues. But I will give you some general idea about what we do in our lab. So this is a portable optical platform, an imaging platform, and this is a combination of an SPR platform and a surface plasma resonance and a camera. So this platform uses a chip that fabricated in a clean room environment, and this chip has a nanometric size nanohole openings here, and these nanohole openings allow light pass through, and this transmitted light monitored by a camera. So when an analyte, biological analyte, stick on the surface, it changed the optical properties of this plasmonic chip, and in the camera you see a reduction in the intensity, in the light intensity. So we recently we used this methodology to detect H1N1 viruses. What we did is we covered the surface with antibodies that has high specificity and affinity to H1N1 viruses. And when the viruses catch on the surface, like for example here, then we see a change in the light intensity. So we use this platform to successfully detect the viruses. We also developed a platform 3D printed platform and also a software. This software take an image using the camera, do the post processing with image processing, and gives you the virus information right away. So as you see here, so we take the sample through a nasal swab from the patient. So we incubate the sample on the sensor chip, and then the sensor chip has two locations. Control there's one spot for control, and the second one is sensor covered with the antibodies. And when you load the chip to the sensor and take an image and and we have a custom-made software. And this software allows us to post-process and give the results directly to the patient. Hopefully, if I give you a lecture next year, I will be able to give you more detail about this platform. The second one is this is not our system. I won't be able to show you the real platform because it's confidential. So we have a microscope integrated to a cell phone. So we can magnify the images more than 1,200 times. So what we can do is we can image the cells. We can even monitor single cells with this device. So what we will do is we will take tissue images with these platform right after the biopsy. So this platform will be used in the hospitals where the biopsy takes place. So after the biopsy, they will the doctors will prepare the samples with small tissues, like 10 micron thick tissues. They will give us the tissues right in the biopsy room. So after the biopsy, they will prepare the samples within 10 minutes. They give us the results. We will take different images from the tissue, and using a deep learning algorithm, we will right away diagnose the cancer patients in the biopsy room. This will definitely expedite the diagnostic time for the cancer patients. So now we are going toward to a financial. So we might have a company soon. So we are working on this part right now. We almost ready our platform. We took many different cancer tissue images. Now we are also working on the deep learning algorithm to diagnostics based on the tissue images and the patterns on the tissue on that tissue images. And I think this was my last slide. So I am happy to answer your questions.
Okay, thank you. Thank you very much, Arif, for your explanation about the material lecture today. And to audience is welcome if some questions, anyone has any questions. Okay, I think how to transform the lab-on-chip research to a real point of care testing. It needs a multidiscipline area, right?
Your question.
Something like a programmable microcontroller to make a small devices, and Yeah, and from electronica and medicine, and also to handle waste, yeah, waste, something like in your lab, sample from your lab, the plasmonic template. How is it the reusable or disposable?
The chip, so you're talking about the chip here, right?
Yeah, the plasmonic chip, yes.
Yeah, the chip will be disposable. So actually here, as you realize, this chip is gold, which is very expensive. So we also work on the ways to fabricate those chips as efficient as possible, with the less time in the clean room, and also with the minimum material, especially gold. So when I was working in the lab as a PhD student, one chip cost maybe $100. Because when you do a research, when you working on those research projects, you stay in the clean room even for one chip. I spent like 48 hours. That's why it was so expensive, and also we were paying a lot of money to the devices to fabricate those chips. But now they're like at the end. So at the end of my PhD, like 5 years later, we figured out a way to fabricate those chips even in a high throughput manner and much cheaper. So for example, I started my PhD, the chip was costed more than $100. When I finished my PhD, it was $6. Now, even if it was a research project, $6 was very cheap. Now I was talking with I talked with different companies. They are fabricating. They could fabricate those type of chips in a much simple way and more high with much higher throughput. When I talked with one of the company in Canada, they told me they can fabricate one chip less than 4 cents. So when you develop fabrication methods, it's the cost of the chip fabrication is less and less. And when you think about this chip is 5 cents, then it's definitely disposable. And they can fabricate using these different nano imprinting technologies. You can fabricate those nano openings in kilometer size. Even like a 1 kilometer size plastic film, you can fabricate those nano arrays. So it's much. So my expectation is to decrease the chip cost less than $1 with antibodies on top. So then that will be a really POCT system. The rest of the device, it's an LED source, which is like maybe $3-4. And I have a CMOS camera, which is about like $300. So this is a very cheap device. So when you think about if even it's a research project, I used a very inexpensive components. That's why it could be a POCT device.
Yes, thank you. And anybody question? Any question? Student?
Maybe one chat here.
Three Garin.
Thank you for your opportunity. This is my name Garin from Unpad. I want to ask about detector. How can one detector use for the many test disease?
Okay. So when we for example, yeah, it's maybe this slide could be easy to explain your question. So for different POCT tests, the way how you do the test is the same, optical or electrochemical. It's exactly the same. The question here, how you use the same sensor for different goals. For example, in this optical biosensor, my main idea to detect the H1N1 virus. That's why I used an antibody that has high affinity to H1N1 virus. If you want to detect COVID-19 virus here, you cover the surface with COVID-19 antibody. So here the specificity, in other words, the analyte to be detected is coming from the ligand. So let me draw you here. So for example, this is your sensor surface. If you want to detect this one or that one, you have to cover the ligand. The ligand means the biomolecule has with a high affinity to the targeted analytes. So if you want to detect this biomolecule, you have to cover the surface with this ligand. If you want to detect this one, you have to cover the surface with this ligand. So the specificity is coming from the ligands. So the specificity, you modify your sensing platform for different targeted by modifying your sensing surface biologically. So you don't change any engineering part or microfluidic part. You change. You do a biological or chemical modification to modify your platform to catch different biomolecules. This could be like viruses, bacteria, or proteins.
Oh, thank you. If we use the DNA sequence, can I trace the another disease like COVID-19 or anything?
Yes, of course, because COVID-19 has a base, like in its DNA, it has like 130 bases. You can definitely diagnose using the DNA sequencing, but DNA sequencing is so expensive. That's the main problem. That's why it's good to have, like, instead of using DNA sequencing, it's good to have like PCR type of DNA, like determining DNA, the location of the bases with the PCR could be much cost effective and maybe higher. When you think of, like, when you talk about DNA sequencing, you talked about you meant PCR, right?
Yeah, PCR.
Okay, PCR. Yeah, PCR is actually the most precise methods. When you compare all these POCT methods, PCR has an accuracy of more than 99%. So it's the best and most accurate method when you think about its cost. But the problem with the you can define any type of viral or bacterial diseases with the PCR, because you access the base sequence in the DNA, so you can reliably identify the virus. When you use PCR for COVID-19, when you look at the DNA base, you can identify the DNA, you can identify its mutant and everything. So, but the thing with the PCR is you have to go to hospital, you have to take the test and wait for 4 or 5 hours. And that's why we have the POCT tests. But if you want to have the most accurate one, PCR is and I think no one can really beat PCR method right now in terms of accuracy and sensitivity. Yes, with the PCR method, you can diagnose many other viral or disease or other diseases based on pathology, pathogens.
Oh, okay. Thank you very much.
Thank you. Another question? You can write on the chat bar if.
I will also, in the chat, I will also give my email address for questions later.
Okay. Is there any question? Hello. You can also write to Arif via email.
Yeah, you can write me an email too.
Okay, I think this time has passed well.
Okay.
We are suffice today lecture. Thank you very much.
Thank you too.
Thank you very much.
Have a great day.
Students and all participants for the participation. See you next week.
See you. Bye-bye.
Don't forget to the student, you will, Dr. Arif will give an exam, right?
Yes, yes.
After next week. Okay. One time, thank you again. And
thank you. Sure.
We finish for today. Bye-bye.
Bye.